People are still joining, so I'll just give it 30 seconds or so. Okay, everyone, are we ready to get going? All my panelists ready to get going? Okay, so hello, everyone. My name is Chris Wellings, and I'm the Assistant Director of the Lambeth Early Action Partnership. So welcome again to our evidence review webinar. So to start, I just want to run through quite quickly some housekeeping points. As always with these webinars, only the presenters and the panelists will be shown on video or heard by audio. Just to confirm, we will be recording the session and uploading it onto our website. You can submit questions using the panel on the right-hand side of your screen, and we will allow for some dedicated question and answer time. We will send the evidence review and accompanying materials via email at the end of the session. And finally, we'll also follow up with a short survey to help us understand what worked well and how we can improve future sessions. So today we're really fortunate to be joined by our two evidence review authors from New Philanthropy Capital, Naomi Jones and Ivana Valle. And we're also very pleased to have Jill Roberts, Sleep's Evaluation and Research Manager, here to participate in the discussion and to answer questions. So can I just hand over to Naomi, then Jill, then Ivana, just to introduce yourselves and perhaps say a little bit about your background.
Thanks, Chris. Good morning, everyone. I'm Naomi Jones. I'm an associate with New Philanthropy Capital, also known as NPC, and I'm also an independent social research consultant and was lucky enough to co-author this evidence review with Ivana. I've been in social research for about 20 years, and a lot of that has focused on early years children and families, so this is very much in my area of interest.
Hello all, my name is Jill Roberts. I'm LEAP's Evaluation and Research Manager. Joined LEAP in 2018 and I commissioned the evidence review from NPC, and we're working with them closely at the moment to have refreshed our theories of change and develop a shared measurement system.
Hi, I'm Ivana Valle. I'm a visiting scholar at University of East London, and I've worked with colleagues at New Philanthropy Capital on this review. I've been doing early years research for over 20 years.
Thank you all. I just want to briefly set the scene for the presentation today. Now, I mean, as many of you know, the Lambeth Early Action Partnership oversees a coordinated portfolio of more than 20 early years services that are delivered in 4 wards with high levels of disadvantage. We aim to support children and their families throughout the early years of a child's life, with a focus on children's early communication and language, their social and emotional development, and their diet and nutrition. And alongside working with children and parents, we also work with practitioners and local services in education and childcare settings, community organisations and system leaders to try and ensure young children are wrapped in positive environments that support their early development. Now, LEAP is halfway through the National Lottery's 10-year A Better Start initiative, and we commissioned this review from New Philanthropy Capital to help us do a number of things. We commissioned the review to help us take stock at the midpoint of the programme, to help us ensure we're focusing on the right areas or the areas where we can have maximum leverage. As Jill says, to refresh our overarching and our lower level theories of change, and to lay the foundations for an evaluation of our delivery and impact. So I hope the review proves as useful to you as it is proving for us. And on that note, can I hand over to you, Ivana, to present the first part of the report?
Just need to get my slides. Can I just check that you can see the slides? Hi, can I check that you can see the slides?
Yeah, they're there, Ivana.
They're there. Thank you very much. Well, thank you everybody for joining this webinar. It's a real pleasure for Naomi and I to be able to share the findings of the review with you. As I said, I've been a applied policy researcher for a long time, and for me the real test of whether a research report is a good one is whether the people who need to use the research find it relevant, useful and accessible. Before we start, actually, we wanted to have a quick poll. I know that Chris said that the review will be sent shortly, but we would just want to get a sense of whether any of you had already had a chance to look at it. So we've got 4 questions for you. Whether you've already read the review, you've skimmed it, or where really you're hoping to get everything the review, the key messages from the review from today, or whether you haven't looked at it. So if I give you a few minutes just to answer one of these 4 questions.
Okay, I think most people have voted now. So no pressure, Ivana and Naomi. It looks like most people are hoping that the session will tell them everything they need to know about the review. And then a very, very small proportion of people, only 8%, has said what evidence review. Some people have read the whole thing, and just over 10% have skimmed it.
Thank you very much, Jill, for that. So we've got, I think Naomi and I have got about half an hour to tell you everything about the review. And just to remind you that if you've got any messages, questions, there is the hashtag A Better Start where you can send them. So the review, as Chris said, was really a chance for the LEAP team to reflect on their theory of change, but also to inform their evaluation plans. The review covered 2 very big topics, which we'll also be covering today. So first, I will start by looking at place-based approach, which is the approach taken by LEAP and by the Better Start program in general to transform and bring about transformational change and sustainable change and improvements for young children. So I will present that part, and then we'll have some questions at the end of that. And then Naomi will go and look at what influences child calm in the early years and what supports children's early development. Just a very quick look at how we did the review. We identified over 1,000 relevant data sources that from the past 10 years that address the kind of questions a review looked at. From these, we selected 31 data sources. So these are reports, articles, books, etc., which were selected for relevance, or particularly relevant to the research question we were addressing, but also they were particularly methodologically robust. And many of those were actually reviews that had been carried out in the past 10 years. As some of you will know, some very good quality reviews of early years have been conducted in the past 10 years. And then from these, we selected some the selected items were summarized using a standard template and with additional references from me, Naomi, and our expert advisor. So as I said, LEAP is a program which is based on a place-based approach, which really aims to transform early year services to reduce inequality in early child development through a collaboration of all key stakeholders, both agencies, families, and the community. And a key question to address for a place-based approach is really how do you know that the program is being implemented as intended? So we looked at what are the key defining feature of a place-based approach. And at the heart of it, you can see that at the circle in the middle, is a collective approach to address some very complex problems, and usually in a very small geographical area, certainly before it's scaled up to a bigger area. A key element of these, which is at the top, is really a focus on predictors of inequalities. A place-based approach is about understanding the circumstances and processes that really produce unfair differences and tackling these. So for example, place-based approaches are often used in health, and you find that those, as well as looking at the traditional areas a health program would focus on, would look at things like transport, the environment, housing that might be causing health inequalities. Without this focus on the causes of inequalities, a place-based approach can't work. The second key element is a shared vision and a reach and resources. So really a place-based approach is about bringing together partnership, which is very diverse. They include very diverse stakeholders, and where often the lack of partnership working was identified as a problem in the past, but a problem that was never successfully tackled. And this is obviously clearly a big issue in children's services. Thirdly, another key element is community engagement. And really this is going beyond consulting occasionally the community and families. It's more about willingness to work on equal terms with the community, making the community at the center of the decision-making process, and ultimately being prepared to transfer control to the community. And the fourth element, without which place-based approach really doesn't work, is that it has to be evidence-based. Evidence must inform all the work of a program. So from assessing what are the needs of the local population and then prioritizing these needs, you also need evidence to select which programs and services are required to tackle these needs. You need to monitor the deliveries of services program is in line with what you would expect it, and also what those who use these services think about the services and the way the services involve them. And ultimately, you have to assess the impact. You have to assess that the program is actually having the intended effect and improving the lives of children and their families in the case of LEAP. And also, being evidence-based often in many place-based initiatives means a very close collaboration between research teams and those who are delivering the program. The other question we were asked to address whether place-based initiatives work. I mean, place-based initiatives are growing in popularity. because there is a recognition that single program, no matter how good it is, and we've seen some really good single programs in early years, they're very good, but they cannot really tackle problems and bring about sustainable change on a socially significant scale, on a large scale. So there have been some place-based initiatives that have generated quite a lot of interest, that have been very successful in targeting the social determinants of inequalities in health and education. Possibly one of the most famous ones is the Harlem Children's Zone in the United States, which is about tackling, has reduced poverty in some of the poorest areas of New York. But even the Big Lottery, as well as a Better Start, has actually launched a number of place-based initiatives. One of the issues with place-based initiatives are the evaluations, the findings are mixed, and the quality, and so is the quality of the evaluations. The difficulty is the place-based initiatives are very complex, and the evaluation designs that we have, the tools that we have at our disposal, are still not quite adequate, because they were more the kind of tools you would use to evaluate a single program rather than something as complex as a place-based initiatives. Moving on to what a place-based initiatives involve. A place, basically, to bring about the kind of transformational change that a place-based initiative like LEAP would require, you really need to change systems. And changing systems really means looking at what's normally invisible. And as I said before, it's really to look at what's holding the problems in place, the problems you're trying to solve. And normally it does imply shifting the power dynamics at place, identifying connections, whether connection and disconnection, where things need to be connected in order to tackle the problem. And also it's really about behavioral change and exposing mental models that might inhibit success and might make it difficult for you to solve a problem. And to really be very specific and very clear about what are the conditions that can help or hinder the transformation that you're aiming to achieve. So a key question for any place-based initiative, but certainly for LEAP, is how do systems change and how do you know it? Because clearly an ultimate test of whether a program has worked is outcomes for children have improved, but this is a very long-term goal. And in the meantime, how do you know that you're moving in the right direction? So we identified 3 stages of system change. One is about defining the boundaries of the system, and we look at the kind of things that you need to understand whether the boundaries around defining the boundaries. The second one is about planning. So it's about defining what's the problem and coming up with potential solution. And the third one is about implementation. How do you implement your solution? And underpinning every stage, there must be the co-production of key stakeholder agencies, families and community, and also learning from evidence, both from the existing body of evidence and from any evidence generating from the evaluation of the initiative. So we now look at how what you'll be looking at these stages to see whether the systems is changing as expected. So defining the boundaries of the system is really about the boundaries of the system must make sense to all the stakeholders involved, and therefore does require very frank conversations. The conversation must also be frank because one must take a pragmatic approach and has to be defining the boundaries of the system is really a balance between tackling some very deep-seated social problems, but also about being pragmatic about what one can achieve. So we have suggested that clearly for LEAP, the key questions to address is what are the boundaries of the system? Do they reflect the systems within a child exist? Do they reflect all the domains of life, not only the traditional early years services and programs one would expect, but also transport, environment, housing, other aspects of life that impact on children. But also we thought it was equally important to look at how these boundaries have been drawn to see whether this is a genuine place-based approach. So he's looking who's been involved in drawing this boundary and who has been excluded. is looking whether evidence has informed the drawing of these boundaries, how these boundaries are communicated, for example, through the partnership that have been established, the provision, what is measured and what is not measured, obviously that signals what's within the remit of LEAP and what is not. And also whether there are mechanisms for reviewing the boundaries. I mean, LEAP, like most place-based approaches, is a long-term program, so you'd expect things to change during this period. Then, looking at planning system change, it really has two phases, two key phases. One is understanding the problem and one is identifying the solutions. Understanding the problem is really fundamental for a place-based approach. It's probably the most transformational act of the whole program, because it's, as we were saying before, is really looking at the root causes. What is causing the problems? What is holding the problems in place? And it's hugely important that everybody is involved in identifying what are the root causes and what are the problem, and who is excluded and included from this process is very meaningful and does have consequences for the shape of the program. And in terms of again, I think we think that as well as looking what the questions what the problems have been defined, it's very important to look at how one has come up with what the problems one wants to be tackled. In early years, the key issue is obviously in understanding the problem is to identify the needs of the population, both at the population level, but also at the individual level. So looking at whether obviously a program has conducted a population needs assessment and what evidence was used for that. Was looking what's the stories the assessment is telling, particularly specific in this case about the LEAP areas. What, apart from any evidence we know generally about needs assessment, needs in the early years, what's specific about LEAP? And also an understanding whether the assessment is owned by the families in the community. If you show this needs assessment to your families in your community, would they recognize as the kind of needs they have and the problems they face? And whether it's also owned and used by all stakeholders. So are all the agencies using the same needs assessment, or do different agencies have different ones? And also there's a question of individual needs assessment, because as Naomi will talk later, there's quite a lot of, we identified a lot of need for targeted support in early years, you would expect it. Do agencies have used the same tools and approaches for identifying which families need targeted support? And again, are there mechanisms for regularly reviewing population needs and how individual assessments carry out? Over a 10-year period, things change, and it's very important that this is reflected. The second part of the planning process is finding solutions. And again, it's about asking questions about how in this case, the LEAP team came up with this solution and whether these are solutions that have been endorsed across the system. And one of the things you want to see if LEAP is working as intended is that there is a growing investment across all the agencies in the LEAP areas in early years and evidence-based intervention. Whether there are signs that budgets are being pooled or aligned to fund evidence-based interventions and programs. You want to look at how early years programs are selected by LEAP, but also other stakeholders. Are they looking at the evidence, or are they testing them to make sure they work? You want to see what the plans for evaluating these programs. I mean, not all programs might have to be, new programs might need to be developed, so they might lack an evidence base, but is there a plan to evaluate them? And also, who is involved in shaping and informing the evaluative work? So this is whether all agencies are involved, also families in the community. Moving on to implementation, we suggested there's some key questions for LEAP to address, to ask themselves in order to understand whether they are, whether the approach is really what you would expect it from a place-based initiative. First and foremost, the place-based initiatives require that there is a collective understanding of which outcomes you're trying to change, and that is used for accountability, to make sure that everybody understands what you're trying to do and contributes to that. And that normally means having a shared outcomes framework, the kind of outcomes for children and families that you would expect. Do you expect outcomes to change and monitor, and you want to monitor whether it's changing in the right directions. And it's very important to understand again how this process, how this outcomes framework is put together. So if you ask families in the LEAP areas and show them the outcomes frameworks, would they think that that's a good way of assessing their needs and meeting their needs, but also of does it reflect the fact they've been engaged in the co-production of programs and services? And other mechanisms for reviewing this framework, you would expect needs to change, particularly at times like these. So there has to be mechanisms for making sure this is refreshed. The other key issue in early years is obviously making sure there's a system for sharing information about families and operational data. So do agencies share this information in a way that is effective? And I imagine that COVID would have provided the real test of that, how effectively and quickly that information was shared in order to identify families who needed support. It's also quite important, all early years work shows that there is a shared strength-based model for working with families, a model that sees families as helping themselves, and services helping families to help themselves. There has to be an indication that the ways of working at different stakeholders, agencies are being integrated. So whether it's training, whether it's co-located teams, whether it's development opportunities, shared development opportunities. It's also important to understand how the evaluation findings are used across the system. If there are evaluation of single program, the system, are they being shared and used by others? And also, and lastly, very importantly, is how the community involved in service provision. It's not always clear from place-based initiatives how this is meant to happen, and this is a decision for the LEAP team to make. But what would this mean in practice? Would it mean that more local people are involved in working in local services, or there is a shift in public services being delivered by community organizations instead, for example, the local authorities? So this is basically a very quick run through of how we thought one should be able to observe if systems are changing in the way one would expect in a place-based approach, and a place-based approach has got a chance of being successful. So we have a poll now for you before we move on to the question, to your questions. We just wanted to get a sense from you of the 4 sort of broad areas that I've mentioned. So a shared understanding of the needs of the local population, how funding is invested across the system, how evidence is used to make decisions across the system, and how families are involved in shaping the program. So of these 4 features of what a system change should look like, a place-based approach should have, what do you think is the most important one? So I hand over to you for the poll.
There's still some people voting, so give it a few more seconds. Most people have voted now. So there's actually quite an even split between about 40% of voters have said the most important feature is how families are involved in shaping programmes and services, followed by 34% of attendees who think that the most important aspect is the shared understanding of needs of the local population. 19% of respondents think the most important feature is how evidence is used to make decisions across the system, and 7% of the vote goes towards how funding is invested across the system, for example, pooled budgets. Thank you to all those who voted.
Thank you very much. It was really, really useful to get a sense from you what of these four things you thought was the most important. And now, just to conclude, obviously we want your questions and comments on our findings about the challenges as a strength of a place-based approach. But we also have a question for you. Of the features that we have discussed of what you should be seeing if a system is changing the way envisaged by a place-based approach, in your experience, have we captured all the key processes, behaviours, issues we should be looking for, or have we missed anything? And then again, your questions and comments, and just to remind you about the hashtag A Better Start if you also want to tweet. Thank you very much.
Okay, so please do send any questions that you have to the questions box, and we'll look through those. So the first question is a nice and easy one, which is about having the presentation slides shared, and we will be sharing the presentation slides to all participants today.
Just to add, as well as, oh, sorry, Jill, it's Laura. Just to add, as well as the slides being circulated, the whole webinar will be recorded and put on our website, and it will have the slides with it and also the evidence review document itself. So that'll all go online later this afternoon as well.
So we have another question come in to ask, how much does paradigm matter, i.e. a system could have a shared understanding that families are, or a shared understanding they are overloaded by poverty and exclusion. So yeah, any thoughts on that to the panel?
Well, I think the question, the issue of poverty is always the big white elephant in the room for early years intervention, because of the, I mean, as Naomi will go and talk about, you know, it really influences a child's life in a major way, but place-based approaches are by definition normally implemented in a small area. But I think it's still important when drawing the boundaries of the system to recognize that the importance of that. So in that case would be parental employment, housing, transport, and what you know, how that affects a child's life. And then in that element of pragmatism, also recognizing what an initiative can and can't do. And I think obviously there is a lot of these issues are more issues for national economic policy, but sometimes recognizing that problem also means that you can find some solutions at the local level. I mean, in relation to poverty, a big issue would be access to childcare, and ensuring locally that all families have access to childcare would be an important way of helping families to for example, access employment, to get better employment, or training locally for parents.
Thank you. Another question's come in is that it's often the perception that the focus mainly on health and education is good, but sometimes what's left out of the inequality puzzle are important variables such as resources for in the environment, as well as cultural transformations. I guess there's anything that came out of the review as being a pretty important aspect of the system.
Yes, I think this touches on what Naomi will cover. I think this is, again, going back to drawing the boundaries of the system. This is why it's so important, and we certainly would have argued that transport would be an important area to look at, as well as housing. So, but again, it's really about drawing your boundaries and understanding and involving all the key stakeholders, and especially involving families. I mean, families will be very good at telling you what matters, and that might be slightly different for each area. And regarding the culture, yes, I mean, system change and place-based approaches are fundamentally about cultural change, changing behavior, changing the behavior of agencies, of senior managers, agencies, but also frontline workers, and changing how they relate to the people they offer a service to.
Great, thank you. Another respondent asked, and you mentioned some examples of place-based initiatives that came out to the evidence review. Are there any particular ones that are really good examples of UK-based place-based initiatives? I mean, you mentioned previously the ABS and National Lottery, but anything else that really came out from the review as good examples?
They're good in the sense they're very interesting, but they've not been fully evaluated. I mean, one that is very, very interesting, I found, is mentioned in the review, is the Camden social work model, which has adopted a strength-based approach and a place-based approach as well. And it's really about shared accountability and links within and between services. And I think it's so important that it's come out in children's social service, because they're often seen as excluded from the rest, where families go when nothing else can, when things get really bad. And I think they're looking at better integration with other children's services, with early years and family services. It's really important. I think that's quite nice. And obviously as I mentioned, the most famous one is the Harlem Children's Zones, which has been running for many years and successfully reduce child poverty in some of the poorest areas of New York, and steps to success. And really, this is about tackling youth crime, but it starts with early years. So just to show that you really have to tackle problems at the root. So it started with providing some early years support in order to reduce problems that might come up earlier on when children become teenagers.
Jill, can I add there just that I mean, there are a number of sort of initiatives in the UK which could be seen as place-based going back over a number of decades. So Sure Start, Extended Schools, New Deal for Communities, Total Place, and now A Better Start. And I think building on and learning from the pros and cons of all those initiatives is really important, because successive waves of policy and effort have done a lot of good in terms of raising absolute standards and absolute outcomes for children, but I think we've still struggled to bring about sustained and significant narrowing of the gap between children from poorer backgrounds and their better off peers. And that's why it's really important to go beyond single initiatives, to provide continuous support for families and integrated support for families that works across the different parts of their lives. So I think there's a big history of place-based initiatives, but I think we're still learning about how to maximise this opportunity and how to do so in a way that will realise the promise of place-based initiatives, which I think is to help us narrow some of those socioeconomic gaps between children from different backgrounds.
Thank you. Other things that people have mentioned as potentially important aspects that might have been missed out. So someone mentioned the importance of taking a trauma-informed approach. Another participant talked about the importance of national and local policy and how that affects local resources as being a key aspect of this work. One of the other questions that's come up is about how this work and this evidence review and the findings, especially around looking at systems change, has been applied to LEAP, and the theoretical approach that LEAP's adopting. So one of the things that we've been looking at as part of this review is we wanted to refresh our theory of change, and to do that we obviously listened to the evidence review and the kind of the key findings from that, but we also consulted with local families and practitioners, professionals and other stakeholders in order to kind of really concisely articulate the key kind of areas of focus of our work. And for a lot of the time we think about the activity of our individual services and how that activity works both individually and collectively across services. But we also wanted to try and think about the role of our kind of backbone team and our programme level activity, about how we can go about achieving systems change. So in our refreshed theory of change, we have kind of 7 key kind of domain areas, and one of those is about promoting collective action and systems change. And under that we have a number of kind of high-level outcomes around shared vision, so ensure that we have a shared vision for children and families across the system, and then a joint approach for realising this vision. We have some outcomes around the work of early intervention. So we want to ensure that we have a thorough understanding of local need and demand, and more integrated planning and delivery of services and resources for children and families. We're also going to be seeking to achieve more reliable evidence about the impact of place-based collective impact initiatives, and ensure that's generated, shared and understood and used locally and nationally for continuous learning and improvement. And then we have an outcome around improved statutory services and child and family provision by other providers. And as part of our work, we'll be looking to ensure that we are routinely monitoring this, and we'll have evaluations to ensure that we're on track to achieving some of these more bigger systems change outcomes as part of the LEAP theoretical approach. Great, so I think we're actually almost up to the end of this first section. Thank you for all your questions so far. What I'll be doing is please still send some questions through, and I'll start to collect them, and we'll have an opportunity at the end of the presentation to ask more questions also.
I'm now going to talk through the second part of the presentation. You should be able to see my screen shortly. Right. So as Ivana said, the review is very much in 2 parts. So we had the kind of whole systems place-based approach, but a core focus of the review was also looking at the factors that influence children's development in the early years. Now, that, as Ivana said, a lot of work has been done in this area already, and it's quite a popular subject for reviews. What made this difference for LEAP was that they wanted to have it all in one place. They wanted to focus on the inequalities, and particularly on what works to support children's development in those early years across these areas that we surfaced. And as we've seen from the evidence that Ivana has presented, predictors of early development and inequalities are a defining feature of place-based initiatives, so especially important for LEAP to surface. So there are 8 areas that we came up with through the review, and these eight areas are not the only ones by any means, and it'd be really interesting to hear at the end which ones you think weren't covered by the reviews, but these are the ones that came through as being potentially most important, and crucially most important for place-based initiatives such as LEAP to focus on. So they are the parent-child relationship, the home learning environment, early education and childcare, parental, mental and physical health, child nutrition, family relationships, families' financial circumstances, and environmental and community influences. It's probably worth saying up front that the review aimed to cover everything about families and parenting and childhood. However, it was really notable how little there was on fathers' roles in any of these areas, and a lot of the evidence was about a mother's role. So there's clearly a gap there, and something that could be filled in the future. Within the review itself, we have given some details of specific interventions that do or don't work in each of these areas. I'm not going to cover those today. I'm just going to give a very quick overview of each of these areas. In each case, I'll just say a little bit about why it's important, and where relevant, I'll talk about what the evidence says is most effective. So we're going to start with the parent-child relationship. As I'm sure a lot of you know, how parents interact with their children in the early years has a huge influence on children's learning, on their cognitive development, and crucially on their social and emotional development. And the literature on this is extensive, and it goes back many years, and a lot of it sits around attachment theory, which speaks about the importance of that parent-child relationship and the need for an infant from very early days to have a secure attachment with at least one parent. And that means when there's a secure attachment, the parent is meeting that child's needs. They are consistently responding and in a way that makes the child feel safe and secure. Evidence suggests that a disorganized attachment happens when that relationship is not so consistent, and so the parenting behaviour might frighten or distress the child rather than comfort them, and they don't feel they can rely on that parent. The disorganised attachment is actually relatively rare. About 2/3 of parents automatically form a secure attachment with their child, and it's a natural thing for them to do. It is, however, more likely that a disorganised attachment will occur in more disadvantaged families, because there are a whole host of pressures that might influence that parent-child relationship. However, it's worth saying that the evidence clearly shows that the quality of parenting behaviours and the parent-child interactions has a greater effect on children's outcomes than parental education level or family income. So it's not that having low financial circumstances means that they will have a poor or disorganized attachment, because actually that itself can overcome other challenges that a family might be experiencing. So within the evidence, this is seen as a really key area and a central site for early intervention. Likewise, the home learning environment. And what's meant by the home learning environment is simply the range of learning activities that children are exposed to at home. So that might be playing with letters and numbers, it might be messy play, arts and crafts, or learning nursery rhymes and songs. But it's also about going outside the home and experiencing parks and playgrounds, libraries and museums. But what's crucial to the home learning environment is the interaction again between parent and child, and the verbal exchanges that take place. So that includes reading activities, and that might even simply be looking at a book and pointing at pictures and saying words. And the quality and frequency of those interactions are crucial. From a very early age, the quality of the home learning environment can support children's language skills, it can support their vocabulary and cognitive and memory skills. And there's evidence that this home learning environment can, in some cases, have more impact on children's wellbeing and achievement than any other factor, including parental education and family income. That doesn't mean it does every time, but it's very, very central to children's development. So for both parent-child relationship and home learning environment, it's clear that they are a central site for early intervention, and that there's real merit in intervening early to support that relationship and to support parents to provide a home learning environment that might best benefit the child. And there's definitely evidence that more disadvantaged parents may be particularly likely to benefit from support. When it comes to parenting interventions, there is some evidence that group-based and universal programs can work, but in that case, the interventions should focus on supporting parents to understand the importance of the quality of that relationship and those interactions with their child. But for both parenting interventions and home learning support, really the evidence leans towards more targeted and intensive programs that can really work with parents much more individually in a much more specific way. And as Ivana outlined earlier, ideally a place-based initiative has a shared approach or tools that support the identification of families who need that targeted support. So there's quite a lot of light touch literacy programs out there, so book sharing schemes, for example, or free book giveaways, and they tend to be very popular with parents. But the evidence we saw suggests that they're not actually necessarily supporting language development in the same way that more targeted initiatives might do. It is the case that improving a mother's educational level, and again, it's very much the mother that the evidence talks to here, can have an impact on children's home learning environment and language. And that doesn't have to be before the child is born. It can be after and in the early years that can still have an impact. So moving on now to early education and childcare, and I'm sure, as many of you know, there's a lot of evidence around the importance of this, particularly when it's good quality early education and childcare, and it can really help with supporting cognitive development, literacy and numeracy, but also that crucial social and emotional development that's really central for LEAP, including child's confidence and some of their physical outcomes as well. What's interesting is that this also has impact on the parent-child relationship. So when a child attends an early educational childcare setting, it can motivate and support parents to engage in some of those activities that we've spoken about, like book sharing and shared language and all those sorts of things that enrich the home learning environment. When it comes to early education and childcare as a site for early intervention, the evidence shows that taking part and attending an early education and childcare setting is particularly beneficial for more disadvantaged children. However, as I'm sure many of you experience, take-up among these children tends to be lower. And so what's crucial there is removing barriers for more disadvantaged families to encourage them to access free entitlement. Doing that, of course, is easier said than done in many cases. The evidence talks a lot about the quality of early education and childcare, but what's challenging there is that definitions of quality really vary. And so the conclusion that we came through our review is that actually perhaps that quality needs to be defined at a local level between the A Better Start team and the early education childcare providers, and crucially the parents, to explore what good quality looks like in a setting and in that area, and how childcare can best meet families' needs. So the next factor that has a huge influence on children's outcomes is parental physical and mental health. And here the evidence was almost entirely on maternal mental and physical health. When it comes to a mother's mental health, there are clear links between children's outcomes both during pregnancy and postnatally. So during pregnancy, poor mental health can negatively affect the development of the fetus, excuse me. And in the early years, where there's more severe mental health issues, that might affect a mother's ability to parent their child. So it might be, you know, at the lower end of the spectrum, it may be just a lower interaction. But in more severe cases, the mother can become very heavily distracted, short-tempered, or even aggressive towards their child. When it comes to maternal physical health, there are 3 ways identified in the evidence that can most affect the children. These are not the only things, but that these came out through the evidence as being 3 of the most important. So the first is fetal exposure to drugs and alcohol. The second is preterm birth, and the third is maternal age at birth. And what the evidence says about that third one is that mothers at either end of the spectrum, so very young mothers or older mothers, carry more risk both for themselves and for their children. So in the case of younger mothers, there's a chance that they're going to be more economically disadvantaged or perhaps lack the life experience or skills to make healthy choices for themselves or their child. Older parenthood comes with risks to parent and child in the form of things like gestational diabetes or preeclampsia, and similar health issues like that. Maternal mental and physical health are clearly important. However, what was interesting is that the evidence suggests that it may have less of an influence on child outcomes than, for example, the parent-child relationship, home learning environment, or a family's economic situation. However, you know, there are huge caveats to that. Clearly, in some cases, it's going to be hugely detrimental to some children. And particularly amongst the population that A Better Start was set up to serve. Support for women in the antenatal period in mitigating the impact of poor mental health, so for example depression, or physical health, for example support with smoking or substance abuse, can have considerable benefits for both the women and children involved. but identifying mothers who need support is challenging. And the evidence suggests that screening is the best way for doing that, particularly for depression and smoking. But also, as Ivana said, as part of a place-based initiative, it helps have shared tools when it comes to screening, and also for there to be good referral systems in place to ensure that if someone who needs support is identified, then that can be passed on to the right agencies. And once identification has happened, then there is a good evidence base of what works to help mothers to deal with these health issues. So actually, it's the identification that sometimes proves to be the biggest challenge. Moving on to child nutrition. I suspect many of you are very familiar with this evidence base. I know a lot of you work in this area and know that nutritional deficiencies in early childhood can result in a huge range of health issues, both in the early years and later childhood, and indeed on into adulthood. And that ranges from things like poor oral health to anemia, to obesity, vitamin D deficiency, but also poor nutrition in the early years can result in challenges for children when they reach school age. So there may be poorer cognitive outcomes and behavioural issues, or they may just generally find it harder to engage, to play, to be with their peers, and all those important aspects that children need in order to be able to thrive. Evidence shows real links between low income and poorer levels of nutrition, which is no surprise. From the evidence we looked at, the huge majority focuses on breastfeeding. So as is well documented, there are multiple benefits to breastfeeding for both the child and the mother. The evidence that we surfaced was largely around what works in relation to nutrition around breastfeeding. There was very little around kind of what happens past that weaning stage. So moving on now to family relationships, and this emerged as being hugely important, not surprisingly, and there are two key ways in which that was identified in the evidence. The first is the interparental relationship, and the evidence around that suggests that the nature and quality of relationship between parents has a huge impact on child outcomes, and that's regardless of whether the parents are together or separated. It's about how they're interacting, no matter where they live or what their relationship status. And when parents are hostile in any way, children of all ages, and that includes infants, exhibit real signs of stress. And what's interesting is that there's also evidence of a link between the quality of the interparental relationship and the nature of parenting practices. So when the relationship between parents results in persistent, hostile and unresolved conflict, for example, this can lead to more negative parenting. It's important to note that kind of breakdown in the interparental relationship is spoken about in terms of a spectrum. So from silence to violence, it doesn't need to be hugely overt for it to have an impact to stress on the child. If parents are not speaking to each other, or there's a real negative energy between them, then children pick up on that as well. And the second aspect of family relationships that surfaced as important was domestic violence, child abuse and neglect. And clearly, when children are exposed to domestic abuse in infancy and toddlerhood, this can result in delays in children cognitively and in terms of their attainment at school, but can also have a really big impact on their relationships and social and emotional development, self-esteem and mental health. And it's no surprise that this is coming out as important. And I suppose, sadly, it's quite likely that in LEAP area and in the wider Better Start areas, that this is a problem that's increased during the pandemic. We know that domestic violence has increased, and this is probably having a knock-on effect. So the challenges are even more than perhaps they were before. There is evidence to suggest that supporting the quality of the interparental relationship in the early years can be just as important as supporting the parent-child relationship. And this is relatively new in terms of the evidence base. So, the parent-child relationship has been seen as central for a long time, but there is now this evidence saying that actually, if you can support that interparental relationship, that's going to in turn have an impact on the relationship that parents have with their children and that central role that it can play. So it's therefore very worth considering as part of the whole system approach that Ivana spoke about. Programs that target conflict management and communication showed real improvements in parenting and child outcomes. And again, it's helpful if those can be well targeted. But the biggest challenge, again, remains screening. So where that's done effectively, to screen for domestic violence at routine interactions with families, so during antenatal care appointments or doctor's surgery and so on, that can have huge impacts on detection rates, particularly when that's coupled with training to increase practitioners' awareness of domestic violence as they interact with families. So moving on now to the seventh area, environment and community influences. It's notable that there was a lot less available evidence on the influence of environmental factors, and actually that the evidence there was considers it to be more of a distal influence in relation to children's outcomes. Now, that doesn't mean it doesn't influence them. Certainly, in many cases, it can have a huge influence, but compared to some of the others, it was seen as potentially less important, and it would be really interesting to hear your thoughts and experiences on that. Clearly, there's evidence around the impact of inadequate housing, which can have an effect on children's health in a range of ways, then has a knock-on effect to academic attainment. And children from poorer families in particular are much more likely to be exposed to toxins, to live in overcrowded or temporary accommodation, or otherwise unhealthy conditions that can really affect their mental and physical health. And unsurprisingly, there are huge inequalities in relation to both housing, but also the access to wider environmental amenities and services that families have. So more disadvantaged families are less likely to have access to green space, to parks, to playgrounds, to clean air, and all sorts of things that are vitally important for children to thrive. So finally, now coming on to families' economic situation. All of the factors that were surfaced by the review indicate a clear socioeconomic gradient, and they, this issue of family economics cuts through every single thing that we looked at. But it's notable that it was seen as having an impact in three areas in particular. The first is health and well-being. So children from low-income families, as we know, are more likely to be of a lower birth weight. They are less likely to be breastfed or breastfed for less time, less likely to receive their immunisations on time, and more likely, as I've just said, to live in inadequate housing, which can then have a knock-on impact onto both their physical and mental health. There's also a huge impact of families' economic circumstances on cognitive and language development and school readiness. So there are direct impacts for children from low-income families having less access, for example, to high-quality educational opportunities, material resources such as toys and books and those sorts of things that help create a positive home learning environment that we discussed earlier. More indirect impacts are parents likely to have lower levels of education, which means that they may be less able to provide appropriate cognitive stimulation for their children. And there's also evidence that children from poorer families end up having lower IQ scores on a range of tests and lower cognitive development generally from the early years than their more affluent peers. And finally, thinking about social and emotional development and the influence of families' economic situation there's evidence that children from lower income families are more likely to have behavioural problems. And there's also a link between economic circumstances and key social and emotional characteristics. So that's self-esteem, self-control, perseverance, resilience, and motivation. So it's clearly incredibly difficult for a place-based initiative such as LEAP to improve the financial circumstances of the families that it's working with, and arguably outside of its direct remit. That said, when looking at a whole systems approach, it is worth considering how that system can collaborate with partners such as financial advice services, employment agencies, educational institutions, to help support parents to increase their income. And likewise, to look at how, as a system, it can support low-income families to access subsidised childcare and ensure that that childcare meets the needs of parents who need to work or study and increase their economic circumstances that way. So we're going to go on now to a quick poll. I'll be honest, we did want to ask you which of those 8 factors that I've spoken through you think has the most influence on children's outcomes. Unfortunately, the webinar software does not allow us to do that. So we have distilled the question into a much higher level one, and that is, in your view, is it possible to identify which factors have the most influence on child outcomes from those that have been discussed? And the possible answers are, yes, some of the factors in the review definitely have more influence than others. No, it's not possible to identify which factors have the most influence, or 3, I'm not sure. So I'll just hand over for you to take a few minutes to answer that poll.
Okay, so a few more seconds. Anyone else wants to vote? Great, thank you to everyone who voted. So the majority of participants, of 68%, felt that yes, there are some of the factors that definitely have more influence than others. And then kind of equal split, 17% and 16% respectively thought that no, it's not possible to say which has the most influence. And finally, 50% said they're not sure.
Thank you, Jill. That's really helpful. Thank you for sharing your thoughts there, because it's incredibly tricky to unpick some of these influences. And indeed, when we were looking at the relative importance of the various influences, what we found is that there is really no evidence that's able to weigh it up. And I guess that's not surprising, because it would be very hard to do a study that sought to understand the influence of one factor whilst controlling for all the others. And children don't live in a vacuum. They are constantly influenced by all of the things that we've discussed and more. And the interplay between those factors changes over time, depending on the stage that the family is at and what stage the child is at themselves. What did come through quite clearly, however, in the evidence was that although economic circumstances definitely do increase the risk of poor child outcomes, they do not determine them. And there is the potential for families who are struggling economically to overcome those circumstances in terms of child outcomes. Supporting parents' relationships and interaction with the children, so that's both the parent-child relationship and the home learning environment, can make a difference regardless of the family's economic position. And with that in mind, the review therefore came to the conclusion that the areas it might be best to focus energies on are the parent-child relationship, the interparental relationship, and the home learning environment. Now, obviously, early education and childcare, child nutrition, mental, maternal and physical health are also important, as is the environmental factors. But it's about focusing energies where there's likely to be most impact. And of course, the complex relationship between these various influences, as I've discussed, and the impact they have on children's early development make it all the more necessary to have place-based initiatives such as LEAP that can work in the round and have a clear shared framework of support, and can work to identify families' needs at those different stages and draw on the partnerships and referrals and support across the system to help support families at the point that they need it. So I think that's quite enough of me wittering on. It's time to hand back to you for your questions and thoughts. And just to get that going, I wanted to ask, what do you think is missing? So from the evidence that we went through, those were the 8 areas that came out as most important. But what other influences not surfaced by the review have you seen to be important in your work?
Great, thank you. So please do continue to share and ask any questions. We've had some through already. So one of the just mentioned about how, in their perspective, there's the environmental and community factors actually have a huge influence on early child development. either that's through supportive networks in the community, the impact of isolation, or child and family communities. And I just wanted to know why you think there might be less evidence available on this factor.
Yeah, it's a great question, because intuitively, I think environment does have a huge impact, and we know that if a child is living in crowded housing or is isolated, that can have a huge impact. I suspect there's less evidence because it's much harder to gather, because it's much harder to monitor the various influences and contexts that make up a child's environment, and it may be that it's simply an area that's under researched. So I think the evidence we found that suggests it's less important to that extent should be taken with a grain of salt, really, because there's certainly the impact, the potential for it to have enormous impact.
I guess to say there that it's kind of a really important role for LEAP and other place-based initiatives to actually generate evidence in this area, to really understand what works and what matters, for these kind of more broader and more distal kind of environmental community factors, and that's where we have a role to play in that. Another question that came in was, what did the review find out about the cumulative impact of risk factors? And was that something that came up in the review?
So yeah, I mean, clearly each of these on their own don't operate in isolation, and when you have a cumulative effect of a child, for example, struggling with a family's poor economic circumstances, which in itself the evidence suggests is more likely to lead to a more strained parent-child relationship and interparental relationship as well, and that will have a knock-on effect on then the child's behaviour and ability to engage at school or in a childcare setting. So actually there is a cumulative effect that each of these can have a knock-on effect to the other. I think there was reference to that within the evidence, but again, it's very hard to unpick, and of course it's all very specific to the child and the family and their circumstances.
Yeah. I guess it's when we think about how we've used this evidence review and our consultation with local families and practitioners and stakeholders to think about how this affects LEAP and the future of the work. And obviously we look across a range of domains, which are a number of risk and protective factors, both at the child level through to the influence on parents, communities, systems change, the workforce, and that's kind of the approach that we take, that we want to make sure that we are taking into consideration those cumulative impacts. Great. I mean, other people have talked about. Sorry, Chris, you go.
Oh, we can't hear you.
Can you hear me now?
Yeah.
So very quickly, just some of the broader evidence on protective and risk factors has suggested that they're not necessarily additive. So, you know, they interact together in interesting ways, and sometimes, you know, children need to lay very positive foundations, and then some later protective factors, positive experiences, can have a really exponential impact on their outcomes. Whereas if they didn't get some of those protective factors in place, that isn't the case. So it isn't that all these factors necessarily, as we've just said, bring equal value, but they interact with each other and have a different effect depending on the combinations of protective and risk factors in children's lives.
Great. I mean, other factors that people have and participants have highlighted include like structural racism, local politics, the neighbourhood, kind of ACEs, as well as generational support and sibling relationships as being kind of key factors that often have a considerable influence on children's development. Another question I wanted to ask is, especially with the review, did you come across any maybe counterintuitive or surprising findings?
Good question. I think a lot of it confirmed what we thought perhaps we already knew. For me, the most surprising finding was around the interparental relationship and the influence that can have, not only on the child but on that child-parent relationship. And just because from evidence that had existed previously, there had been less emphasis on that. So that was a relatively new element that was surfaced by the review. But Ivana, you may have others that you want to share.
I suppose what was interesting was to be able to look at these most distal factors, environment and transport and housing, and in answer to the questions from someone earlier on about why we haven't got more evidence, I think also that's researchers' fault, because we have reproduced the boundaries of agencies. They when look at early years, they only look at education, health, etc. And in a way, we have failed to look beyond that, to look at more widely at factors that might influence, even if they might not reflect the boundaries of the agencies that commission research, like the Department for Education, Department for Health. So I think we've got a responsibility there as well in terms of making sure that these factors are taken into account in future.
Great. Thank you. I mean, a few people have talked about the importance of ensuring that you get the input of diverse communities when shaping programmes. And I was wondering if what came up in the evidence review about this, but then also, you know, I think Chris is obviously we can talk about what LEAP does in this area too.
Yeah, I mean, perhaps it was perhaps an omission in the evidence review that this didn't come up, and we were, as Ivana just alluded, we were kind of limited by the search terms in that we had to put some boundaries on those terms in order to avoid having 50,000 results. So we didn't specifically look at the importance of diverse communities, but there's clearly potentially a huge evidence base there, and that's, you know, clearly likely to have an impact. So it'd be interesting to hear from Chris as well what LEAP is doing there.
So I mean, LEAP has a number of levers, I guess, that it's trying to pull to make sure that we engage with our whole community. We have a team of parent champions, so around 35 parent champions at any one time, who do work around setting up parent-led groups, running befriending services and signposting. We've got a relationship with 4 local community organisations, so one in each of our wards, who run a series of events and catch-ups for us. They each employ a family engagement worker who really leads that engagement on the ground. We have parent and community forums for each ward, which occur consistently throughout the year, so that parents can sort of voice their opinions and engage with local policymakers. And we've got a really excellent team of parent representatives who attend those parent forums and then attend our board meetings. So we've got a whole range of different activities to deal with the sort of to try and reach out to and engage with the variety of communities within LEAP, but undoubtedly there's always more to do, so it would be great to hear people's ideas.
Thank you. And a few people also mentioned how, and this kind of goes back to kind of a bit more bringing the 2 parts of the presentations together and about systems change, but they talked about how actually institutionalized practice can be very hard to shift to achieve systems change. And so the question was around how can you create a kind of a cohesive approach that both reaches but also influences the very top level of organisations and decision makers, especially considering the very important role of community, so community members and community connectors, and how you can kind of work with that, and considering there often will be power imbalances between those different people who influence the system. Not sure if anything came out of the review around that, or Chris, you can talk a little bit about how that kind of LEAP's approach to ensure that community voices go right to the top, and that we can try to influence this kind of more embedded institutionalized practice.
I mean, something that we do have at LEAP is that, as I say, our parent representatives are at our regular board meetings. They make presentations and feedback from the parent and community forums. And that's a really important opportunity, I think, where you've got lots of sort of directors of the Director of Children's Services and the Directors of Commissioning between the NHS Trusts and the Council, and a number of senior representatives from the NHS Trusts and Chair of the Voluntary Sector Forum, all in the room there, engaging with and responding directly to the views of parents. So that's one sort of mechanism that we use at LEAP.
Could I mention, sorry, just add to that. I mean, I was lucky to work at the National Children's Bureau for a number of years, and one thing I learned from there is how to include children and young people in research, in research activities and shaping the research. And I have to say that was a huge learning for me. We took that involving children and young people in research well beyond what I thought could be, possible when I worked in more conventional research organization. And the value to the research was immense. You could see how it improved the quality of research, the scope, how you were less likely to know things that, for example, what we were discussing before, transport or housing, because that doesn't come into what you traditionally look at. And the other plus of involving children and people, it made the presentation, the research findings, so less boring and more engaging done by researchers. So that was one of the areas where we work quite a lot with young people and children, was to present the research findings, and that was really, really helpful. I mean, I have to say that I would highly recommend that. So in any evaluation of research work you do, to have the community and families really closely involved with work with you, it adds quite a lot to the research, and its credibility, I think.
I think it's also worth mentioning that LEAP has, to its credit, been through a process of mapping its system with NPC, and coming back to that point of institutionalized practice. It would, I think that was a really helpful process to go through to kind of challenge what's happening. I think it was it's not an easy thing to do, to sit down and map exactly what the systems are doing, and really trying to understand how these various influences that the review had surfaced influences the services, and how they're all linked together, and how that then aims to influence other aspects of services further and create change for the local families. And so just going through that process, I think, was really helpful to help shake up institutionalized practice and question some of that.
Great, thank you. We've almost got time for questions. There were quite a lot of questions come through, so thank you so much. What we'll be doing is kind of collating the questions at the end and also responding to those in written format as well. I mean, a question that's come up a few times, and we have touched on, is the importance of this kind of wider family and friend influences, so kind of grandparents and support networks. And I guess the question is, to what extent did that come out of the evidence review, and similarly also to LEAP, in terms of what work do we do to ensure that we are really involving these kind of wider support networks in the work that we do.
So in terms of the evidence review, it wasn't, unfortunately, that wider influence wasn't directly within our search terms. So we kind of deliberately had to make some difficult decisions about what not to include, just because it was a very large review. And there is an evidence base around kind of wider family and friend influences. I think what comes through in terms of that parent-child relationship and attachment relationship is also that as long as a child has at least one trusted adult that they can turn to, whether that be a parent or a carer or a grandparent or someone else, that will increase their chances in terms of outcomes. So it doesn't necessarily have to be a parent, and that did come through in the review, but we consciously didn't seek out evidence there. So that remains a gap in terms of this review.
Thanks, Jill. And just from, I mean, we have one of our domains that Jill outlined. One of our no priority domains is around building community capacity and building the links between parents, as well as connecting parents to services. So all of our sort of program of community events, and in fact many of our services are sort of underpinned by this idea of connection and social capital, and building up these contacts and relationships. So not just the parent-child relationship, but that really essential relationship between parents and other parents, so that people have got people to turn to and rely on and ask advice from. So that's really critical to LEAP.
Great, thank you. So I think we'll probably wrap up there. So I'll hand over to Chris, and Naomi and Ivana for any final comments. But to say thank you very much, everybody who's attended, and we'll be back in touch with the responses to all those questions that have come in.
Thanks, Jill. Yeah, I mean, it's been a great session, and we've had we've had really brilliant attendance. I mean, around 100 people, which is absolutely brilliant. So I just want to say thank you to Ivana and to Naomi and to Jill, and thank you to all of you for participating and for being part of the session. As I said at the start, we'll send through the presentations and the evidence review by email, and we will also be sending through a short survey because we're doing a program of these webinars, so it will be really useful for us to understand what works well and what doesn't work well so that we can continually improve. And finally, I hope you'll consider joining us for our next webinar on Friday the 16th of October. That will be on race and equality, exploring the needs of our early years community. So once again, thank you very much for coming, and thank you to all our attendees and our panelists.
Thank you.
Thank you.